You just got a positive pregnancy test and you're very excited. You have not yet processed all the feelings that you are experiencing because of this news. And then, bam, hits morning sickness, vomiting, nausea, tiredness, things that you did not expect and you do not know how to tackle. Can be very difficult as well. Yes, so in this video today, I'm going to talk to you about what is morning sickness. Why do you experience this morning sickness, vomiting or nausea during pregnancy? Some home remedies that you can use so that you do not have to suffer through the ordeal of vomiting through the day. Some alternate medicines that could help you manage this. And I will also tell you about what to do if you have extreme vomiting and you're not able to tolerate drinking even a little bit of water and you're not able to eat any food at all. In that case, what do you do? So stay tuned and watch till the end of this video. Hello, I am Saranya, the founder of Babypedia and a birth professional. I am a childbirth educator, lactation counselor, a golden period educator, and a baby yoga instructor with more than 5 years of experience helping around 1,000 couples navigate pregnancy, birth, and early parenting with a lot of ease. So what is morning sickness? Morning sickness is when you have nausea, that is the feeling that you want to vomit, or you are actually vomiting during pregnancy. So this can affect almost 80% of pregnant women. Though it is called morning sickness, it can happen or you can experience these feelings at any time of the day or sometimes even throughout the day. And it usually starts somewhere from the 4th to 5th week of pregnancy. That is, once you get the urine pregnancy test, or for a small percentage of women, they can start getting it even before you get the positive test. The light feeling of nausea, and that is when they suspect they are pregnant. But for majority of the women, it will start after you get the positive test, and that's around the 5th week. And it will go on to the 12th week or the 16th week. That is around the 3rd to 4th month when that is ending. But for a small percentage of women, that is 5% of women, can experience vomiting or nausea till the day they go into labor, some even during labor when they are delivering their babies. But like I said, it is only for a small percentage, that is 5% of women will experience it throughout their pregnancy. Mostly women will experience it only in the first 3 to 4 months. Okay, so now why do you experience this vomiting and nausea? There are a couple of reasons, but none of this is proven. Okay, these are all just theories that have been told as a reason. So there's no scientific proof for it. So the first one is because of the increasing changes in the hormones in your body, especially the HCG, that is the human chorionic gonadotrophin hormone, progesterone and estrogen levels that increase when you are pregnant. So this can cause a little bit of nausea or vomiting in you. So ironically, these are the hormones that are ensuring that your baby is growing well, and these are the same hormones that will give you mood swings and morning sickness during pregnancy. This could also be genetic, wherein your mother or your aunt or your cousin, your sister, anybody who you are related to by blood experienced nausea or vomiting during pregnancy. Then you also have a higher chance of getting this morning sickness during pregnancy. If you are pregnant with multiple babies, twins, triplets, or more than that, then the hormones that your body is producing is going to be higher than when you have a single baby. So then you could be experiencing morning sickness as well. In case you have a history of migraines or motion sickness even before you became pregnant, then this will increase your chances again. And if you have an imbalance in your dietary micronutrients, especially potassium and magnesium, or you suffer from low blood sugar levels or low levels of vitamin B6, then studies tell us that you could be having a higher chance of experiencing nausea or vomiting during pregnancy. Finally, sometimes if you have thyroid abnormalities or imbalances during pregnancy, this could also trigger nausea, vomiting, or morning sickness during pregnancy. So these are some of the reasons of why you experience morning sickness, that is nausea, vomiting during pregnancy. Okay, so mild nausea and vomiting during pregnancy is normal. It can be managed at home with a lot of home remedies that I will be telling you in a short time. But what if you have extreme vomiting? That is, you're vomiting for more than 3 to 4 times a day. You're not able to tolerate any food, and you are having, you're not even able to drink water. You are showing signs of dehydration. That is, you have a severe headache, or you are not passing any urine, or your urine is like really dark colored. You feel dizzy whenever you stand, or you are experiencing electrolyte imbalance because the salts in your body are getting imbalanced because you're vomiting always, or you lose weight during pregnancy. This is the extent of the extreme vomiting nausea that you are feeling. Then what do you do? Well, this is a medical condition that is called Hyperemesis Gravidarum. That is, if you continuously vomit and you're not able to keep any food down. Now, this could lead to a lot of health issues, not only in you but in your baby as well, like malnutrition, dehydration, and imbalance of salts and acids in your body. It could lead to, if it is very extreme, it could lead to kidney damage, low vitamin levels. It could also cause a tear in your esophagus or your food pipe because of all the vomiting that you have been doing. It could lead to more reflux, constipation in some mothers, and dental erosion. So why dental erosion? Because when you vomit, it brings up all the acid in the stomach, and when this acid comes in contact with your teeth, it can erode your teeth as well. So these are some of the extreme reactions that you can have if you have a lot of excess vomiting or you are suffering from hyperemesis gravidarum. So in case you are suffering from hyperemesis gravidarum, then please meet your doctor immediately. Your doctor may advise you to get a lot of glucose, a lot of electrolytes and salt passed on through your IV for you, and your doctor will also prescribe some medications that will reduce the amount of nausea that you are experiencing. So if you do not want to experience dehydration or any other complicated issues because you're not able to eat well or drink anything, please contact your doctor and get the remedies for this hyperemesis gravidarum. Okay, so now coming to some home remedies that you can try for morning sickness. Yes, you do not have to suffer through it. You can try these. Now I'm going to give you a big list. Try everything. Some of it will work for you, some may not work for you. Now stick to the ones that work for you. Okay, so the first one is try to eat small amounts of food regularly. So if you're not able to eat like too much of food, at least just a biscuit or so, you can try eating dry foods like Marie biscuit or bread, because all this will reduce the feeling of nausea and you will be able to tolerate it. Remember, if you're not able to eat anything, now is not the time to concentrate only on eating healthy. Whatever food you can keep down is okay at this particular point. As soon as you wake up in the morning, before you get out of bed, even when you are lying down, just have one small Marie biscuit or any crackers, or you could also have rusk, bread, etc. Why? Is because these are all dry food that will go in and it will absorb all the stomach acid that has been secreted throughout the night, and this will automatically reduce the amount of nausea and vomiting that you experience during the day. Next, do not wait until you get too hungry, because that is when a lot of stomach acid has already started secreting. Always eat even before you start feeling hungry or the early signs of hunger. Okay, next would be take a diet that includes a lot of whole foods with a wide range of vitamins and minerals and micronutrients to ensure that you are at least getting a certain percentage of the nutrients that you need through the little bit of food that you are able to manage. Also ensure that you are taking food that is rich in potassium like bananas, and magnesium, maybe like dark chocolate, because in case you are suffering from nausea and vomiting because you have low levels of potassium and magnesium, then this will rectify all the vomiting that you are experiencing. Okay, so this will help balance the potassium and the magnesium levels, and so this will help as well. You can get magnesium also through your skin, so you can dip your feet, or if you have a tub at home, you can just dip your whole body inside warm water that contains, that you have added magnesium sulfate or Epsom salt too, because this magnesium will be absorbed through your skin as well. Try to avoid a lot of spicy or fatty food, because this is going to irritate your food pipe and your stomach because of all the vomiting that is already there. Try to go for very bland food like bananas, dry toast, maybe idlis, plain potatoes. You can go for gelatin. You can go for broths, or like a vegetable broth, chicken broth, eggs, tofu, applesauce, etc. Okay. Try to have small healthy snacks in between your meals so that you don't get too hungry. So this could be yogurt, it can be, combine the carbohydrates with protein. So if you're having an apple, just dip it into a bit of peanut butter and then you can have the apple. Also ensure that you're drinking plenty of fluids, especially water. If you're not able to tolerate water, then you can have you can infuse the water with a little bit of cucumber or a little bit of mint leaves. You can also have a mixture of a little bit of infusion. You can have cucumber, you can have a little bit of mint, you can also have a little bit of chia seeds into it, or any flavor. Just squeeze a little bit of lemon into it, or any flavor that you actually like. You could also try herbal teas. Always check for the herbs if they're okay during pregnancy, and you can go ahead and drink a lot of herbal teas. Okay. Now, you can try changing the time that you take your prenatal supplements, that is your iron tablets, your calcium tablets, your vitamins, your folic acid, etc. Because sometimes if you either change the brand or you change the timing in which you are taking these tablets, you can feel a difference in the amount of nausea, vomiting that you are experiencing. Sometimes if you really feel that this is your trigger, the supplements are your trigger, one particular supplement like iron is your trigger, you can talk to your doctor and check if you can stop taking these for a couple of weeks. But don't do it by yourself. Check with your doctor and then take this decision along with your doctor. Okay. Now, very important point. Most of us will have a trigger when it comes to nausea and vomiting. So for some, it could be when they become too hungry. For some, it could be if they have a headache or if they have not slept properly. For some, it could be triggered by one particular smell, like the husband's deodorant smell, or this rice cooking in the kitchen, or they get any other smell, the laundry detergent smell. For others, it could be because of the bright lights from their mobiles, laptops, etc. So first, if you have any trigger, first notice whenever you feel the urge to vomit. See what brings it on, find out what your triggers are, and if you deal with these triggers, then that by itself will reduce a large amount of the nausea and vomiting that you are experiencing. Okay, so always try to find out what your triggers are. You could also make tea with fresh grated ginger, or you can drink peppermint tea. If you're not able to tolerate fresh ginger, you can also get these dry ginger candies. You can eat this dry ginger roots, also called sukku in Tamil. You can take that, you can mix it with a little bit of honey and you can have it. This will help you manage the feelings of nausea. You could also take a lemon on an orange, that citrusy smell, and keep smelling it through the day. This citrusy smell will also help you manage this nausea and vomiting. Also ensure that you get plenty of rest and keep your rooms well ventilated. Okay, so turn on a fan, open the windows, or just go outside and walk for a couple of minutes, 5 to 10 minutes in the morning, in the afternoon, in the evening, because we know the fresh air and getting sunlight can also help you manage extreme nausea and vomiting that you can experience during pregnancy. Okay, so now you could also go for something called aromatherapy. This is like an alternate medicine technique that you can buy essential oils that are suited for pregnancy. You can put a few drops on a hanky and you can smell it through the day. Or you could also use an essential oil diffuser where you diffuse it. It's electrical, or you could get the ceramic ones, and you could fill the whole room with the smell. So this will also help you prevent nausea. So some of the oils that you can use for aromatherapy, some of the scents would be, lavender, chamomile, peppermint, ginger, lemon, and mandarin essential oils are known to work to help reduce the amount of nausea and vomiting a person has. Remember that this is very subjective. So somebody who likes mandarin may not like the smell of peppermint. So you will have to try to see which one works for you. Always ensure that you buy these essential oils from a trusted source so that it is good quality, and do not ever apply these essential oils directly onto your skin or ingest it, because it is very, very strong. In case you want to apply it on your hand to keep smelling, mix it with a carrier oil like coconut oil or sesame oil, olive oil, dilute it just a few drops in, a cup of coconut oil, and then you can apply that on your skin and keep smelling it. Or you can just put a few drops, like I told you previously, on a handkerchief and keep smelling it if you do not have a diffuser at home. You can hold the bottle itself below your nose and you can smell it throughout the day. Okay, so get a good quality one. Just don't buy anything randomly off the internet. Okay, some of the other alternative methods or medicines, therapies along with aromatherapy could be acupressure, acupuncture, and hypnosis. But for these three, there is no solid research, but a lot of women who have experienced this tell us that they have reaped a lot of benefits from these methods. But one thing that you will have to notice and be very precautious about is go to a practitioner who is certified and who is really good at what they do. because that is very important during pregnancy. So go to somebody who's certified or who has learned how to do acupuncture or acupressure or hypnosis for women during pregnancy, so that you can, you are going to somebody who you can trust, and there is not much of risks to doing it during this particular period of time in your life. Okay. And one very important thing before I sign off is, every time you vomit, please rinse your mouth with water. I know for some of you it can be very difficult to even think about putting a drop of water in your mouth, but it is advised to try rinsing your mouth so that it does not erode your teeth. If possible, just add a small quantity of baking soda to the water that you're using to rinse, because baking soda is alkaline in nature. We know the stomach acids are acidic in nature. So this alkaline will neutralize the effect of this acid on your teeth, and it will preserve your teeth so that you're able to enjoy eating, biting all sorts of food till a ripe olden age. Okay. So I hope you found this video very, very, very helpful. Nausea and vomiting, I totally understand, can be very, very tough, not just physically on a person, but also emotionally and mentally, because you may not be able to go about your whole day. You may not be able to do your general routine. If you're somebody who's working, you may not be very productive at work. You may be feeling very tired and irritable because of this. So anytime you're experiencing any sort of low mood just because of all this nausea and vomiting that you're experiencing, I just want you to remember this one thing. This is just temporary. This too shall pass. You may come over it in a couple of months, or maybe once you are not pregnant. Every time you experience these emotions, you can also just close your eyes, take a couple of deep breaths in through your nose and out through your mouth. That's my favorite way of breathing to relax. And imagine your baby, because all this vomiting, all this is for your baby to grow well, right? So just imagine your baby, and you will slowly feel all that love for your baby, bring it out. You will feel yourself relaxing, and you will feel yourself get that mental strength and energy to navigate this period and come out of it as a strong mother. Right, so I will see you soon in another video. If you found this video helpful, please press the like button. You can subscribe to the channel to get more good information on pregnancy, birth, and early parenting. And always follow us. Thank you. And this is Saranya signing off.